So now you see the metal framework on our model. Now you can easily understand this is another model because the color is different, right? It's not white as it used to be. So this is the base of our acrylic partial denture, right? That was wax, just that wax, 2 millimeter thick wax, right? Now you see this is completely different. The metal framework is like 0.8 to 3 millimeters, sometimes more, for the reinforcements, the connectors. It's more difficult to prepare the teeth to be placed on the framework. You see, here it was kind of easy. You would just take the teeth, trim a little bit maybe of them, and then just place it there, because the space is the full space from the gingiva to the occlusion, to the antagonist, right? But here, in this case, we have a kind of a lot of metal, right? And so we needed to trim a lot from this tooth, and we need to create a hole there to put this tooth in that pin, in that metal pin. See, some parts are pink, some parts are white, because we want to mimic the teeth and the gingiva. We don't want the metal, the gray metal, shining through, right? So now I know, okay, it will be like here. I know where it will have to sit in relationship to that metal pin. So till here, okay, slowly making sure that I don't reduce too much from the labial side of the tooth, because then my metal framework will shine through. We use burrs of different shapes, round, thin, ball-like. That's called lollipop. This spherical one. So it doesn't have to be a very, very strong burr, because acrylic resin is kind of soft. You know it, you touch it during your studies, so you know how easy to work it is. So now I check it, and I say, does it fit? Well, not enough. So slowly I cut more, I trim more, not too much, because I don't want to have my framework shining through the tooth, artificial tooth. So we place it there. We needed to have it in contact with, you see, with a neighboring teeth. So slowly begins to sit in position. As you can see, I do most of what I can in the palatal zone. The labial half, I leave it intact. So slowly it starts sitting into the right position. It's not that easy as it may look. You need kind of, to be kind of experienced, to be able to know exactly where to trim And this in relationship to the final position you want the tooth to have. Of course, you trim a little bit more than necessary, that's for sure, but shouldn't be too much. See, this is too long, says the technician, because he realizes that if we placed it like that, the incisal margin would be too low. So we shorten it, but trying to keep the shape that this cervical zone originally had, because this shape is convenient for our clinical case. So, yeah, right, now it's better, but we have to trim more from the inside. Here I want a little bit of a space between the margin of my tooth and the metal framework. There we'll have only pink acrylic resin, which is pink, right, to look like a gingiva. So the cervical margin should not be very thick, but not too thin, because again the framework will shine through, will show through. It will become too translucent, the tooth, if it is too thin, if we trim too much. So slowly we kind of placed it in place, right? It's somewhere there. A little bit more on the inside, because I don't want the mucosal part to get into contact with the metal framework. Again, I want a little bit of a space there for my wax, with which I fix now the tooth to the metal framework. So that will help me. And of course that will be also the retentive part of the acrylic resin. Because as we know already, the wax that we place there will become acrylic resin, right? So in this way I adapt each element singularly, right? Every single tooth. So I already prepared that, the frontal teeth. So once I have them all prepared, I can fix them there with wax. Of course, this is done in relationship to the antagonist. We do not have it here, but this is not done just like that in the hand. You need to have the antagonist and to have everything placed in an articulator, right? So you see that you have to do it in relationship also to the neighboring teeth. So the technician places some wax to fix the tooth into position in this pattern. Yeah. It's a wax pattern and acrylic or composite teeth. Could be porcelain teeth as well, but they're not a very good solution for dentures. Composite is the best, acrylic is okay. So now you see the technician fixes everything into position. The incisal margin should be like, what, 0.5 to 1 millimeter lower than the margin of the lateral incisor. On the other hand, if I see that this is too long, I can easily trim from it at the end when I place the denture in the mouth, because then I see exactly what's happening. And besides, there's no old patient using such dentures that has a very, very nice and untouched incisal margin, right? So it's okay if I make it a little bit longer rather than shorter, right? If you leave it like this in the final denture, this will betray that this is artificial, right? You have to trim a little bit from there, like the natural abrasion of a tooth. So now, if I'm okay with the position, I just fix it with wax. Okay, but again, in the articulator and checking with the antagonist. Right, here is just a demonstration, nothing more than a demonstration. That's why the technician is not doing that now. He doesn't even have this model placed in an articulator, but normally you do. I mean, there's unthinkable to do it otherwise, because then the patient will not be able to bite, right? Okay, so now we have to pay very much attention to the vertical line, to the interdental line in between the two incisors. And when we're satisfied with this, we just place our acrylic resin. I mean, we place our wax there. We fix everything with wax, and this wax will become acrylic resin that will hold everything in place. And I want this to be I want to create there, to model there, a very fine passage between wax and metal, that will be between metal and resin, right, in the final denture. Here I mimic a little bit the gingiva. Of course, I don't like this metal that is left open there. I mean, if the patient smiles more, it's going to be tragedy. So, but that's the old school. That's how people were doing it years ago, many years ago. Now it's different. Now you just place this directly on the mucosa, on the gingiva. So that's the second central incisor. A little bit of wax, a little bit more wax, to make sure that the tooth will be retained, so to say, in that wax. Sit in place in the first moment. Have a little bit of a tack back when we place it there, and then, of course, as you saw, we will add some more wax to fix everything in place. That's the papilla that I'm imitating here. So according to the patient's age, we will create a bigger or smaller papilla. Yeah, old men, they have less papilla. Young people have a longer papilla. But I need to make sure where I will finally place the cervical margin of the tooth. But this is when I do the refinishing. Okay, so now, again, the second tooth is placed. The second incisor. They have to sit at the same level. You see how the technician is placing his hand there? To see how it will look when the lips come over. Right? So he mimics the lips of the patient with his fingers. So, yeah, we have to know exactly how those teeth has to be placed. So those are rules that will be clearly described in our studies. So nothing is a guess. We know exactly what we need to do. Of course, there are some variations, but kind of small variations. Yeah, the rules apply, well, maybe more than 90% of them. They have to be respected as such. And then a little bit of variation, yes, that's possible, but not too much. So now the technician decides to fix the second tooth in place, in position, with wax, final fixing with wax, and then again the passage between metal and wax now, which will be passage between metal and resin in the final denture. So now even on the labial we're okay. Also on the labial. So we do the final one, which is the lateral incisor. See a little bit more modeling at the interdental papilla. Just to have enough wax to be able to model it with the scalpel in the final retouches and refinishings of this framework pattern, actually. The framework, metal framework, is already there. So now the lateral incisor. As you can see, the metal framework sits on a model. What model? Of course, it's not the duplicate model, but it's the master model, from which the wax has been washed completely. The wax that we used to modify the master model in order to duplicate it, right? So that's the lateral incisor. Of course, you need to have the right teeth for this, the right teeth for the case, for the clinical case. And then the technician decides how much away towards the labial those teeth shall sit in order to make it sure that the arch is perfectly continuous from canines, lateral incisors, central incisors, and in the same time that there is no space in between the teeth. And there you need to have a very soft passage between metal and wax, metal and resin in the final denture. So this needs to be strong enough, and we decide that now in wax, right? Because then the resin will copy the shape that we give now to our wax. We need to cover all the spaces there to have wax fully embedded in wax. And yeah, now the refinishing on the cervical regions, modeling the papillas and the gingival margin. Again, a very, very nice passage between metal and wax. Also on that side, on the labial side. Everything has to be perfectly clean. So for this you need to see. You need to see very well what you're doing. Magnification is highly recommended. Interdental cleaning, as you can see. So everything has to be as clean as possible in order to give us the right shape of the denture from the first shot, and not to force us to do it later. When, you see, now if you overdo it and if you make a mistake in wax, you can modify. But then in resin, if you trim it and if you cut it and if you damage it, then what? Of course you can add, but it's way more difficult. So the best is to work now to have everything perfect. So I don't want undercuts here. I want to fill everything with papilla, because you can imagine when the patient is eating, then some food material could get into those retentive areas and look unpleasant, yeah, while the patient sits at the table. So that's how we place the teeth. Of course, we will continue on the lateral region, on the terminal side.